Doctor apprenticeships, the pandemic, child poverty. Is the NHS really doing enough, or are we just ticking boxes? Hey everyone, welcome back to the Aspiring Medics. I'm Katie, a medical student at the University of Birmingham, and today we're going to go over 10 important MMI questions all about current affairs which could come up in your interviews. This would range from mental health in the elderly all the way through to the pending winter crisis. Let's get started.
Station 1. Mental health issues among the elderly are on the rise. What strategies can the NHS implement to support the psychological well-being of older patients?
So this is a really relevant and important question. Particularly in 2025, we're facing an ageing population with a rise in mental health disorders like depression and anxiety. We have to take a multifactorial, holistic approach when dealing with this question, and I'm going to try and focus on 3 important factors to consider: early prevention, digital communication, and community outreach programs. Firstly, with early prevention, it's really important to prevent the onset of mental health disorders before the crisis even occurs. Ways that we can do this is to try and encourage routine screening in primary care, which is often the first place that people go for their healthcare needs. Ways that we can do this is offering support if we identify any early warning signs, and that's something that all healthcare professionals should be trained in. Another way is by encouraging digital communication. In 2025 and beyond, we're living in a vastly technologically advanced world, and the elderly population needs to be also kept up to date with the changes in technology, because it can really benefit the population with limited mobility and enabling wider access to healthcare. And lastly, it's about community outreach programs, supporting intergenerational projects between the elderly and younger children, or also encouraging just the elderly communication with the different social groups or care groups, those kinds of things to combat loneliness, which is the biggest driver of mental health disorders. So to summarise, I'd want to first talk about early prevention, digital communication, and finally communication outreach programs to deal with the question in a holistic, patient-focused way and prevent the onset of mental health disorders before they even start.
Station 2. Analyse the factors contributing to the recurring winter crisis in the NHS and propose effective strategies to mitigate its impact on patient care.
The winter crisis is a recurring challenge that we face in the NHS, and it's really important to consider the fact that it's a complex issue. For this question, I want to target my attention first on the drivers behind the winter crisis before then proposing strategies and solutions that we can address. Firstly, the winter crisis is difficult because respiratory infections such as influenza and COVID become much more common in the winter season, and that can drive an increase in patient admissions and people needing urgent care. This, along with our ageing population with complex care needs, means that this population of patients are even more likely to be admitted to hospital, and hence it becomes difficult to meet that demand for care. Secondly, we're also faced with limited bed capacity. Even now, hospitals are struggling to meet demand, so adding on that higher requirement for beds in winter season means it becomes very, very difficult to try and address the supply needs that we need during that period. And lastly, there's significant staff shortages, and that means that patients are less likely to be able to get the care that they need, and we're not able to branch out the services to everyone who requires it, particularly in that winter period where people need more care than average. So now talking about some solutions or strategies that we can have to deal with all of these factors. And I'm going to move on to talk about some strategies that we can use to try and address root causes behind the winter crisis. Firstly, increasing educational campaigns and preventative measures to try and reduce the rate of admission in the winter period is really important. Things like promoting hand hygiene in schools, wrapping up warmly in the winter season, and really encouraging flu vaccinations can help to improve self-care in the public and prevent people from being admitted to hospital before the crisis even begins. Secondly, increasing communication between the healthcare service and the social care service is really, really important to try and reduce the cap on bed capacity, because a lot of patients can have a smooth transition between the healthcare service and the social care service that would free up some beds that we really need for that important winter crisis period. And lastly, increasing staff flexibility can really help to address the staff shortage problem. That means using temporary measures such as agency or bank staff to help to meet those high demands in the winter period, and also improve the quality dispersion across the services to ensure that patients, despite needing more care in the winter season, are able to have their care needs met. So just to summarise what I've talked about, for the factors that are driving the problem, it's seasonal increases in infections such as COVID-19 and flu, limited bed capacity, and also staff shortages really help to perpetuate the winter crisis. And some strategies that we can do to improve the outlook for the winter crisis be increasing preventative measures such as educational campaigns and flu vaccination, empowering staff and increasing temporary staff measures to try and support people during the crisis, and also improving the transition between the healthcare sector and the social care sector so that beds can be freed up for people who need them the most.
Station 3. How can the NHS address disparities in maternal healthcare outcomes for ethnic minority women to improve access to prenatal and postnatal services?
So this is a really important question, particularly as studies have unfortunately shown that ethnic minority women do face a higher risk of adverse healthcare outcomes during pregnancy and the postpartum period, and also have a limited access to healthcare services compared with other women. First steps in addressing this question is to show the impact of using language access services. Doctors and healthcare professionals using professional interpreting services like Language Line can really revolutionize care and reduce barriers that ethnic minority women face. It enables them to understand their care plan, ask questions, and follow medical advice safely during the peripartum and postpartum periods. Secondly, ensuring that there's culturally sensitive discussion with healthcare professionals and the patient themselves can help to develop culturally appropriate and respectful care plans that women are more likely to follow and be content with. And lastly, considering community outreach programs can be really helpful to reduce barriers such as fear, isolation, and fear of the transport as well. So that involves creating services like support groups in local environment, having home visits that can really support ethnic minority women to access healthcare services and help to reduce that disparity. In my own work experience at hospital, I was fortunate enough to witness doctors using professional language interpreting services like Language Line, which were really helpful to ensure that the patient was comfortable to ask questions, build a rapport with the doctor, and able to follow that medical advice safely.
Station 4. Recent data shows a decline in childhood vaccination rates. Consider reasons for this trend and how the NHS can improve vaccination uptake and protect public health.
Vaccination is a big hot topic in the NHS today, and unfortunately we have been seeing a steady decline in childhood vaccination rates. In order to go about answering this question, I first want to talk about vaccine hesitancy, which can stem from parents concerned about side effects, misconception in the media, but it's also really important not to lay the blame in parents solely or also like trusted community leaders. It's also a wider social issue that we need to address. Further, talking about barriers as well, there can be a lot of transport barriers. Parents can often have busy schedules, which mean that it can be really difficult to find time to take children to get their routine childhood vaccinations. And in order to think of strategies for this, we need to focus on a multifaceted approach with vaccination rates to try and improve that uptake. So talking a bit more about the solutions, it can be really important to engage the community directly in the vaccination services. And this can involve talking to trusted local community leaders or religious leaders to try and promote vaccination and help to discuss with parents one-on-one about the benefits of vaccination and also help to reduce the misconceptions and misinformation that they might have heard in the media. And secondly, in terms of wider barriers, the HPV vaccination programme has been a very successful UK-based vaccination programme, and that's because the vaccination system is delivered in schools. This alleviates the burden of parents having to take their children for their routine vaccinations, and children are instead surrounded by friends who are also being vaccinated at the same time, which can be a comforting environment for everyone to be vaccinated in. These two factors can really help to drive up the vaccination rate in the UK.
Station 5. Assess the challenges faced by emergency services in meeting response times and quality of care, and explore innovative solutions to enhance emergency medical services.
The reality is there's been a drastic increase in ambulance waiting times, and that has had a very negative impact on patient experience and outlook, as medical emergencies can't be managed in a timely manner. I'm going to break this down into 3 main challenges and 3 potential solutions to try and improve ambulance waiting times. Geography and location are really important issues to address. In urban environments, congestion and traffic make it difficult for ambulances to reach medical emergencies in a timely manner. And equally, in rural environments, the vast distance between the ambulance service and the medical emergency at hand can make it difficult for them to reach patients in time. Secondly, there's been an increase in the strain on the ambulance service due to resource limitations like lack of advanced medical equipment and ambulance shortages, as well as shortage of staff in terms of paramedics and other emergency key workers. And lastly, there's been a drastic increase in the number of non-emergency calls being made to emergency lines that significantly put additional strain on the emergency healthcare systems. In terms of solutions, the first thing is including telemedicine technology. Telemedicine technology is a strategy that we can employ in the ambulance service, which would allow paramedics to communicate with specialists live and determine whether a patient needs hospital admission or whether they can be treated on the scene. This can significantly reduce the number of ambulance waiting times, as patients can be potentially treated in their homes and not escalated to secondary care. Secondly, in terms of resource allocations, there's been an increase in the number of predictive analytic services being used. This is allowing paramedics and other emergency workers to localize the high-risk areas and be able to triage ambulance services to target that area and predict when emergencies might occur. Furthermore, there's been an increase in the number of community response first aid workers. So that means that when an emergency occurs, they can be the first to go to the scene of the patient. They're often much closer than the emergency services, and they can respond first to the emergencies before the ambulance gets there. That can significantly improve patient outcomes. And lastly, public awareness and education campaigns of when to call 999 or when to call an emergency line can be really important, as it allows the public to be more aware of what constitutes an emergency and what constitutes a non-emergency and be able to deal with their problems respectively either way. This can really help to reduce the strain on the emergency services and ensure that medical emergencies are being reached in a timely manner and patient outcomes can be improved.
Station 6. Discuss the benefits and challenges of introducing apprenticeships for medical training and its potential impact on addressing doctor shortages.
Yeah, so the apprenticeship program is a highly debated topic at the moment, with a series of advantages and disadvantages that are being looked into. First, I'm going to talk about the advantages. So that involves the fact that there is a significant shortage of doctors in the UK, and having an alternative route into medicine can really help to block up that shortage and be able to attract more people into medicine. It also helps to attract professionals from a wide variety of backgrounds. For example, it can help to attract more allied healthcare professionals that have already got some clinical experience into pursuing medicine. And it helps to alleviate that financial burden as well, compared with a traditional medical degree. Now, talking a bit more about the disadvantages, since it's quite a novel approach, it's important to consider factors like the educational standards have not yet been standardised across the UK, and also there's quite a rigorous educational curriculum that needs to be investigated a bit more. Also, there might be limited career mobility abroad, as internationally the apprenticeship program might not be as recognised, so that might come in the next few years with increasing recognition of the apprenticeship pathway into medicine. But it's important at the moment to bear those things in mind, and that there might not be as many opportunities to practice medicine abroad when you're pursuing that pathway.
Station 7. Analyse the potential benefits and risks of adopting a voluntary opt-out system for blood donations in the UK.
So firstly, I want to define what an opt-out system for blood donation might look like. So this system would mean that everyone's automatically registered as being eligible to donate blood unless they explicitly state their refusal. What this might look like in practice in the UK would be receiving alerts on your phone if you have a blood type that is in significant shortage and you require to donate your blood. However, your informed consent would still need to be taken before you donate any blood. Firstly, discussing some of the advantages associated with this system would mean that there's an enhanced donor supply of blood. This means that there's good and stable supply across all the blood types, including the rarer types, which we might not achieve today, as blood donation tends to be in much fewer numbers. Another factor that's quite beneficial as well is it delivers good, stable supply over prolonged time. Sometimes in the UK there tends to be fluctuations in blood donation numbers, where there might be less across the winter period or more across the summer. However, ensuring that there's an opt-out system might mean that there is a stable supply throughout the year and ensure that there's not as many shortages in the NHS for blood, and it means that we'll be relying less on imports of blood as well, which can be costly and difficult to manage the blood effectively. Now moving on to the disadvantages. The first disadvantage we have to consider is patient autonomy, which, as you know, would be the first pillar of medical ethics. We have to ensure that when we're creating an opt-out system, that people are informed of their rights and their ability to refuse to have their blood taken, and also on the day of blood donation, their ability to refuse in that setting as well. So it should not be the fact that we're avoiding their autonomy, but we should be respecting it as well. Secondly, it's important to consider some cultural and religious barriers as well. There's certain religious populations that might be more opposed to donating blood or blood donation products in particular, For example, Jehovah's Witnesses might be more against blood donation and also receiving blood products, so it's really important to take those religious views into perspective and respect cultural differences. Lastly, with blood donation, it would mean that there's an increased requirement for screening for blood-borne diseases as well. If we're increasing the number of blood donations and eligible donors, inherently there's going to be a greater risk of blood-borne diseases, which will require more intense screening programs as there's a larger supply of blood available. And also it will be really important to screen individuals that are donating their blood as well for any undiagnosed coagulopathies or undiagnosed bleeding disorders that would put the individual at risk when they go to donate their blood. So in summary, there's a lot of advantages and disadvantages for creating an opt-in and opt-out system, and it might be a more highly debated issue in the years to come.
Station 8. There were 4.2 million children living in poverty in the UK in 2021 to 2022. As poverty affects nutrition and health, how can the NHS work with schools and communities to improve the health of children living in poverty?
Child poverty is a complex systemic issue across the UK that goes beyond health alone. However, the NHS has a really crucial role in mitigating its impacts on the health of children and young people. Some more direct initiatives that we can do are through schools, for example, ensuring that every child has a nutritious, well-balanced meal. Also, delivering health education talks about topics such as nutrition, exercise, mental well-being, and sleep and dental hygiene. Also, ensuring that we deliver PSHE, resilience and mental health education in schools to ensure that children are coping well and the psychological toll of poverty is not taking a toll on the health of the child. From a parent and carer perspective, we can also have allied healthcare professional or dietitian talks of schools of what to feed children to ensure that they're making healthier choices. We can also deliver some information regarding on early warning signs of illness in children and how to seek help when required. From a wider health perspective, we can also deliver targeted screening interventions in schools, for example, doing eye checks or dental checks for all children, and ensuring all children are registered with a GP. There's also some other vaccination initiatives that can be present within schools, for example, the successful HPV vaccination program. All of these different factors can help to ensure that child poverty does not take a toll on the physical and mental health of any child.
Station 9. The duration of medical degrees in the UK should be revised. Analyse the implications of shorter or longer courses on training quality and workforce readiness.
So despite this seeming like a straightforward question about whether to implement longer versus shorter medical school degrees, it's actually a question over the quality of the education, because that is what it should be at its core. So firstly, evaluating having a shorter medical degree. Some of the pros could be that we're already under an NHS which is under strain. So if we have a shorter medical degree, we can help to push out more doctors to meet that high demand. However, on the flip side, it might mean that we're making doctors that have less clinical exposure, less opportunity for problem-solving skill development, and they might feel less confident in implementing safe patient care. These are some significant considerations. On the other side, however, for implementing a longer course, some advantages would be that it allows students to really investigate an area of interest to them, explore more research opportunities in their area and really decide whether a specialty might be for them or not, and also gain more clinical exposure in that setting as well. On the flip side, however, we also have to consider the worsening staffing gaps in the shorter term when we're implementing this change. We also have to be wary of the additional financial burden that it might cost for students, and this might actually dissuade students from pursuing medicine in the longer term if it has a much extended degree and having to pay for more tuition fees throughout. Therefore, in conclusion, we've talked about the implications of having a longer degree and the implications of having a shorter degree, and it's definitely an issue that's going to be continuously debated in the next coming years.
Station 10. Analyse the impact of the pandemic on public health behaviours and suggest strategies to promote healthy lifestyles amidst ongoing challenges.
The pandemic was a time of global uncertainty and a global healthcare crisis, and it brought about many changes, both positive and negative. Firstly, talking about some of the positive aspects of the pandemic, we saw a vastly increased awareness of good hand hygiene practices and an increased wearing of face masks, which helped to reduce the transmission of both COVID-19 but also other respiratory illnesses like flu. We also saw an increased uptake of vaccines as well, and increased awareness of the importance of vaccination as both a personal effort and also a collective public responsibility, and increased understanding of the philosophy behind herd immunity. Some of the more negative aspects of the pandemic include things like reduced access to routine healthcare appointments and routine healthcare screening services. For example, cancer services were particularly badly hit. Another aspect was also deterioration in mental health. People were isolated from friends and family, the time was filled with anxiety and fear, and also people were less able to go outside for exercise or go outside in general. So all of these factors really contributed to a decline in mental well-being. Moving on from the pandemic now, in an era where it's not as much of a current concern, we are still able to take some of the practices from the pandemic into our modern living. We are still observing good hand hygiene practices. In my own personal work experience, I observed some patients wearing face masks around the hospital wards, which really helps to reduce transmissibility of different infections, for example, flu or COVID-19. There's also been an increased number of remote consultations in primary care, which has really empowered people to speak up about their health concerns without having the burden of taking time off of work. There's also been an increased number of digital technology, for example, watches that measure heart rate, which has really empowered people to take their healthcare into their own hands. To conclude, the pandemic has brought about a lot of positive and negatives both at the time and has caused a series of healthcare changes even in modern day society that we're still adjusting to and living by. That's the end of the video. Thank you all for watching. I really hope that you found it useful. If you did like the video, please be sure to like, subscribe and drop a comment if you have any questions or opinions to share. That's all from us. See you in the next video. Bye!